What is miliary TB? Can it affect your brain? Imagine tiny millet seeds scattered throughout your body. That's what miliary tuberculosis looks like under the microscope. It is a rare but serious form of tuberculosis, where bacteria spread through the bloodstream and affect many organs at once. Unlike the more common lung-focused tuberculosis, miliary TB can impact the liver, bones, bone marrow, and even the central nervous system, which includes your brain and spinal cord. This widespread infection happens when the bacteria escape the lungs and travel through the blood, creating small spots that can be seen on imaging tests like chest X-rays or scans. These spots are usually less than 2 millimeters in size and can appear in large numbers, giving the disease its name. Symptoms are often vague and can include fever, fatigue, loss of appetite, weight loss, and general weakness. Some people may also cough, experience chest pain, or cough up blood. Because it affects multiple organs, symptoms can vary widely from person to person. When the brain is involved, it can cause a condition called tuberculous meningitis, which is an infection of the membranes covering the brain and spinal cord. This can lead to headaches, confusion, fever, neck stiffness, and changes in mental status. Early diagnosis is crucial because, if left untreated, miliary tuberculosis can be life-threatening. There are 2 main types of miliary TB, acute and cryptic. Acute miliary TB tends to affect younger people and develops quickly, with symptoms like high fever, night sweats, and cough. Cryptic miliary TB often affects older adults and may develop more slowly, with less obvious symptoms such as weight loss and fatigue. People with weakened immune systems, such as those living with HIV/AIDS, young children, and older adults, are at higher risk of developing this form of tuberculosis. To diagnose miliary TB, doctors relying on a combination of clinical evaluation, imaging tests, and laboratory analysis of samples to detect the bacteria. Treatment involves a long course of antibiotics specifically targeted at tuberculosis bacteria, often lasting at least 6 months. Early treatment is essential to prevent serious complications, including damage to the brain if it is involved. If you experience symptoms like persistent fever, unexplained weight loss, or neurological changes, it's important to see a healthcare professional promptly. Remember, tuberculosis is a serious disease but is treatable with proper medical care. Always consult with a healthcare provider for personalized advice and diagnosis.